Welcome back. He has been a practicing psychologist for 35 years, often guiding patients how to get back on track.
But COVID forced him to dig deep and follow his own advice. Here's senior health correspondent Monica Robbins with a COVID long-haul story we can all learn from.
It started like so many others.
I was sleepy, I was a little groggy, and I had some muscle aches. Didn't feel well at all.
December 10th, 2020. Ken's wife took him to Cleveland Clinic Avon. He had COVID and would need a ventilator. He wouldn't gain consciousness until 2021.
I do remember one day being in there, and Jan and a couple of our closest friends were outside the window of the room that I was in, and I could wave to them, and that was it. That's all I remember.
Recovery slowly transitioned to rehab, and then finally, after 90 days, Ken went home.
And I've got to admit, I was fearful. He was fearful because we knew that our dining room was becoming a hospital bed.
18 months later, Ken is still in rehab. He is a COVID long hauler.
Well, I still go every week, as I have since then. Once physical therapy was done in the home, I started back to outpatient physical therapy because of muscle weakness, balance off track, the numbness in my arm from the radial nerve damage issue, building strength up so I could do things on my own.
Ken has made gains, but as weeks passed, his progression slowed. The psychologist had to dig deep and really take his own advice to keep going.
I had worked with so many people over the years who went through different, obviously whether mental health issues or even physical illness issues. And I always talked about no stinking thinking. You can't have a negative attitude. And then my faith was very strong too.
Ken wasn't the only one.
Our own kids have said to me, how did you stay positive? How did you stay strong? For me, it would have been faith, family, friends, healthcare workers that were strangers that became friends.
Yeah.
Ken DeLuca hopes his story shows others recovery is a journey, taken one step at a time.
You control your attitude, and you can control which way you want to go. You want to go forward or you want to go backwards. So I always say, learn from the past, look forward to the future, and keep growing.
According to new data released by the CDC last month, nearly 1 in 5 Americans who had COVID is still suffering from long-haul symptoms. Younger people and women seem to be more at risk, but no one is immune. And it will take years for researchers to figure out why symptoms are so varied, which is why nearly every hospital system now has a COVID long-haul clinic. Monica Robbins, 3 News.